Hello everyone, my name is Alex Ponte and this is a test tube demonstration. The main idea came along with the purpose of helping to provide protection by reducing the testing and treatment accident as well. In today's market we have several types in manufacture in syringes and test tubes. Open at the top sometimes with a rounded U-shaped bottom, and some are large designed specially for boiling fluids. These tubes are designed to draw a predetermined volume of blood. Some with different additives are used for collecting specimens for different types of tests. For physics and chemistry, they are usually made of glass for better resistant to heat and corrosive chemical and longer life. The ones made from expansion-resistant glasses can be placed over a burning flame. Culture tubes for biology are usually made of clear plastic by injection molding and often discarded after use. The tubes are covered with a color called plastic cap. They often include additives that mix with the blood when collected, and the color of the tube plastic cap indicates which additive the tube contains. The vein is punctured with double-ended hypodermic needle. Its inner part is being protected for safety by the holder. When the test tube is pushed down into the holder, the rubber cap is pierced by the inner needle, and the pressure difference between the blood volume and the vacuum in the tube forces the blood through the needle and into the tube. The filled tube is then removed and another can be inserted and filled in the same way. The plastic caps are opaque for tubes with a normal vacuum. Translucent top tubes contain a weaker vacuum in the same sized tubes and will obtain less blood for smaller sized veins. Material for a venipuncture procedure. Safety needle number 22 or less. Butterfly needles of 21 or less. Syringes, blood collection tubes, tourniquet, antiseptic, individual package, alcohol wipes, gauze or cotton balls, sharp disposal containers, anosha acceptance, puncture-proof container, bandages or tape. The procedure. Identify the patient. Outpatients are called into the phlebotomy area and ask their name and date of birth. Reassure the patient that the minimum amount of blood required for testing will be drawn. Wash your hands and put on your gloves. Then position the patient with the arm extended from the straight line from the shoulder to wrist. Do not attempt the venipuncture more than twice. Notify your supervisor or patient's physician if unsuccessful. Select the appropriate vein for venipuncture. The larger medium cubital, basilic, and cephalic vein are most frequently used, but others may be necessary and will become more prominent if the patient crosses his fist tightly. Apply the tourniquet 3 to 4 inches above the collection site. Never leave the tourniquet for over a minute. If a tourniquet is used for preliminary vein selection, release it and reapply after 2 minutes. Clean the puncture area with 70% alcohol pad. Wait for the skin to dry and do not touch it after cleaning. Now we perform the venipuncture. Attach the appropriate needle to the hub by removing the plastic cap over the small end of the needle and inserting it into the hub. Twisting it tight, remove the plastic cap. Twisting tight, remove the plastic cap over the needle and hold the bevel up. Pull the skin tight with your thumb or index finger just below the puncture site. Holding the needle in line with the vein, penetrate the skin and enter the vein in one smooth motion.
¿Ya apago?
Holding the hub securely, I inserted the first test tube following the proper order of draw into the hub, penetrating the stopper. Blood flew into the evaporated tube. After the blood starts to flow, release the tourniquet and ask the patient to open his or her hand. Remove the tube by holding the hub securely and pulling the tube off the needle. Place the cotton ball over the puncture site and remove the needle. Immediately apply slight pressure. Ask the patient to apply pressure and for at least 2 minutes. When the bleeding stops, apply a fresh bandage or tape. Properly dispose of hub and needle attached into a sharps container. Label all tubes with patient labels, initial, date, and time. When multiple tubes are needed, Proper order to avoid cross-contamination and erroneous results as follows. First, blood culture, yellow tubes, coagulation tubes, light blue, serum tube, with or without clot activator, the red, heparin tube, the green, EDTA is the lavender, and glycolytic inhibitor is the gray. Each tube containing an additive should be gently inverted 5 to 8 times after being removed from the heart. Do not shake or mix vigorously. Phlebotomy must not perform venipuncture on artery or feet. Do not label the tubes prior to venipuncture. Do not leave the patient's room before labeling the tubes. Do not dismiss the operation before labeling the tube. Do not label the tubes using a pencil but with black ink pen. Do not leave the patient until you check to ensure the bleeding has stopped. Wash your hands effectively in warm running water before and after each patient collection. Gloves must be worn during all phlebotomy, changed between patient collection but in palpation veins. A coat or gown must be worn during all collections. Needle and hubs are single-use and must be disposed in appropriate containers. After procedure, needle must be never recapped, removed, broken, or bent. Contaminated surfaces must be cleaned with fresh, prepared 10% bleach solution. All surfaces are cleaned daily with bleach. In case of accident, with needle stick, immediately wash the area with antibacterial soap, express blood from the wound, and contact your supervisor.